we need to start firstly by, I need to first start addressing the issue of the interview that happened yesterday that pertained the incident of overcrowding and women sleeping on the floor in Mamelodi Hospital, because it's something that we need to clarify. And it's important to also mention that the interview conducted by NCA, the first part of the clip of the interview was basically an off-record discussion between myself, my media team, and the journalist concerned, because the manner in which the video was presented to us, we needed to verify the facts, because as the health department in Gauteng in particular have been indicted with a number of videos and pictures which in many instances have been, they actually seek to portray the department in a negative light. Usually our first step when we see such videos, we always want to verify the veracity of the video or the information presented to us, whether they are true or not, and which facility. And secondly, as part of resolving the matter, is just to be able to be responsive and resolve the complaint immediately. It has been our stance since we started our term of office that we don't shun away from accountability and transparency, and we have never at any point denied the challenges that the healthcare system in Gauteng faces. This incident is pretty much regrettable, and how the whole conversation got out of hand. Would like firstly as an MEC to firstly say on behalf of myself and most probably my family that I would have to express my heartfelt and sincere apologies to the patient, the complainant, and to all South Africans in the manner in which I responded. It showed a lack of empathy and a bit of irritation. It's something that the leader should know better and should not do. And it's something that we need to say and expressly say without fail and without doubt, to say that it's something that we need to deal with in that manner. That we are pretty much sorry, and also further that we went on to do an interview with the same journalist where we clarified the issue. You would know that there were a lot of videos that have been circulating which already have been fake news and needed us every time we have to verify the information. There was a video of monkeys that was circulating, and it was purported to be one of our hospitals in Gauteng, and we had to verify that. So these are fake news that we normally have to deal with. There was also a video of women were sleeping on the floor, and it was not a video, it was a picture, a photo that was put last year on the social media, also purporting to be one of our hospitals. And that's how we respond to it. So firstly, we have to verify the veracity, and secondly, deal with the issue and the complaint as it actually emerges. We have never shunned away from accountability and transparency, and we sincerely actually sorry about that. We noted from the journalists that on the video, which was showing a group of women sitting on the floor at a health facility, the situation immediately was brought to the attention of the CEO, a very capable CEO who have managed to turn around Mamelodi in the last 6 months since he has been there. He immediately resolved the matter. He indicated to us that he was not aware of the situation. But secondly, that the issue of these women, these are mothers ordinarily without lockdown and without any situation dealing with COVID. These are mothers that come in the morning to breastfeed their babies and then they normally leave. But because of the difficulties of the public transport, These are mothers that have been. So these are people that are not necessarily patients. They've all have been discharged from the hospital, so they are only coming to hospitals only to breastfeed their babies, and would know that dealing with the COVID-19, there are a number of things that we have to adjust to. Also, since we know, and I think the Premier mentioned it here, that we have cleared out Tshwane district to make sure that it remains a COVID-19 hospital and it be able to accommodate patients with COVID-19. So it's regrettable that this incident happened this way, but already we have resolved the matter and the CEO has been dealing with it. It's also important to mention here, Premier, that Mamelodi Hospital has actually under renovation. There is a ward that has been actually extended as part of our promises that we have done last time, that the 10 neonatal ICU beds have been a part of that, and also 10 high care beds have been, and also 3 neonatal isolation beds, and 8 kangaroo mother care beds have been, and 20 larger mothers beds ward are under renovation. And these are renovations that could have been finished by now, but because of COVID have not been finished. But work is underway and we needed to deal with that.